I'm coming, coming to dance, to dance. We're gonna dance, we're gonna dance, we're gonna get down, we're gonna get down.
Hello everyone, welcome to Chat Night Africa. Chat Night Africa Live, about to begin.
Boogie woogie, and when we jam, it's out of sight. This song right here.
Chat Night Africa Live, about to begin from Washington DC metropolitan area.
I'm coming back. I'm coming back. I'm coming to get down. We're gonna get down. We're gonna get down. We're gonna dance. We're gonna dance. We're gonna dance. I'm coming.
Hello everyone, thank you for coming on.
We're gonna dance.
This is Chat Night Africa Live, special edition.
I'm ready. I'm coming.
I'm coming back. If it matters to you,
dancing.
it matters to us.
I'm
At
dancing.
Chat Night Africa.
We're gonna dance. We're gonna dance. We're gonna party. Party hardy.
Production directors Emmanuel Wayindi, John Tango Ashfire in Bamenda, Central Africa.
Southside. This song right here is dynamite. I'm ready. I'm coming.
In just a moment,
I'm ready.
we will be linking up with Dr. Patricia Noumedem.
I'm ready. I'm coming. I'm dancing. I'm dancing. I'm ready. I'm coming. We're gonna dance. We're gonna dance.
This is Chat Night Africa
I'm
Live.
coming back.
I'm coming back.
I'm coming back.
This is Chat Night Africa
I'm
Live.
coming. We're coming to get down. I'm coming. I'm coming to dance.
In just a moment,
We're gonna dance.
Patricia
We're gonna
Noumedem will be appearing on the
We're gonna
platform.
dance. We're gonna dance. We're gonna get down. We're gonna get down. We'll party. We party hard.
Special broadcast of Chat Night Africa Live from Washington DC metropolitan area.
We'll jam. It's out of sight. This song right here is dynamite. I'm ready.
This is Chat Night
I'm
Africa.
coming.
I will try to connect
I'm
with
coming
Dr.
back.
Patricia Noumedem in just a
I'm coming
moment.
back.
But I've sent you
We're gonna
an
get down.
invite.
We're gonna get down.
As soon as you accept it,
We're gonna
you
dance.
will be live on Chat Night Africa
gonna dance.
Live.
I'm coming to get down. To get down. We're gonna dance. We're gonna dance. I'm ready. I'm coming. I'm coming to dance. To dance. We're gonna dance. We're gonna dance. We're gonna dance. We're gonna dance. Oh, when we party hard.
Thank you for joining. Thank you for joining. Share, talk, invite. This is Chat Night Africa.
And
Special
when we
broadcast.
jam, it's out of sight. This song right here, it's dynamite. I'm ready. I'm ready. I'm
In just a moment,
I'm coming.
we have now Patricia Noumedem. Hello, Doc. How are you doing?
Good afternoon, Mr. Divine. I guess we had some technical issues, but I'm glad I'm on finally. Good to see you
Very
again.
good. Now, tell us, who is Dr. Patricia Noumedem? Introduce yourself to the audience.
Yeah, good afternoon, audience. I am Dr. Patricia Ayuk Noumedem. I am an ambassador for Jesus Christ. So I represent my Savior in everything I do. I believe that he has left me in this world to be able to positively transform lives. So I also have the privilege to have undergone some training as a pharmacy doctor since 1994. I graduated with my doctorate degree at Howard University College of Pharmacy, my alma mater that I'm very proud of, and proceeded to do a 1-year postdoctorate training, which is a residency in Philadelphia at Temple University. I did general pharmacy and also some emphasis on alternative medicine and geriatric care. So I practice as a pharmacist, as an associate professor at Harvard University for the past 25 years. But I am an ambassador for Jesus Christ.
You teach you teach pharmacy. If my facts are accurate, isn't it paradoxical that you are championing the cause for herbal natural medicines alternative and homeopathic medicine?
Not really, because again, if you look at it, there's a resurgence, which means people are going back again to really discovering that the natural medicine is really the way to go. And if you look back in history, so many years before, 400 before Christ, Hippocrates, the father of medicine, he said, "Let thy food be thy medicine. Otherwise, your medicine will be your food." And a lot of the medication, the synthetic products that we have out there, Mr. Chamukong, they actually come from natural substances. Take insulin, for example. Insulin that is used for diabetes, it comes from either like, you have the cow, it comes from the horse, it comes from natural. But then because they have to mass produce, then they're going to do synthetic, bioengineering and all of that to be able to mass produce. So many other products, even like the aspirin, even the digitalis glycosides for heart conditions, all of those come from natural substances primarily. But then because of mass production, they have to do synthetic. And then there are so many issues because they add a lot of chemicals and stuff. All those excipients, patients start having problems. So, going back to natural is really a resurgence because that's where it all started.
The truth, Dr. Noumedem, is the medications that you folks dispense at the pharmacies do not come without their own problems. So what is somebody to do? What is somebody to do? If I have a fever, do I go to the pharmacy? What do I do? The truth also is that the pharmaceutical products that you dispense, that you give out following medical prescriptions, some across the counter, they have proven their mettle. So what problems do you have with the things that you are teaching people to do?
Wonderful. I am not totally against using medications. I'm a pharmacy doctor and I'm an associate professor. So I train doctors of pharmacy. I teach them about medications and I see patients and I talk to them about medications and how to properly use their medications. But then my whole goal is to help people realize that they cannot depend on medication because trust me, over the years, Mr. Chamukong, I come across a lot of patients that some of them, the medication is like their God. They just believe that, okay, once I take my medicine, that it does it for me. And I'm like, not really, because medications overall are poisons. Medications are chemicals that they react, they interact, and then they can cause all kinds of issues. So yes, they go into our receptors in our cells and they produce some effect that could be temporary, but then because there are receptors everywhere that they could produce, for example, you can have a good medicine, like I'll say a medicine for high blood pressure. I'm going to use lisinopril. It just came to mind. So lisinopril is a good medicine for high blood pressure, hypertension. So that is going to help to control the blood pressure. But guess what? It has side effect. The patient will start coughing, and that might not be it. There's another life-threatening condition called angioedema that is associated with that. The potassium, which is an electrolyte, can go up, and then they have to put you on other medications to take care of the cough, another medication to take care of the swelling, which the swelling, some patients have died from angioedema. It's a severe life-threatening condition. So just using that as an example, we're saying that it's a vicious cycle, and it is really incumbent upon us healthcare professionals to come out and to tell patients that yes, medications are really helping to provide some kind of relief, but they are not something they want to depend on for a long time. So I believe in temporary measures, but then because medications, again, it has become a vicious cycle where you take one medicine, and like I said, for example, it causes either the diarrhea or the constipation or the angioedema, the swelling, etc. And then they have to put you on 2 or 3 other medications to be able to remedy or take care of that particular problem. And those medications also cause other problems. And at some point, the patients that we see, I do a lot of brown bags locally and internationally in health fairs, and people come with a big bag of medicine because of the side effect of this and that, and all interactions, etc. So the whole mindset is that medications they have their benefit, but then patients can quickly, if they can learn to adopt lifestyle changes, there are a lot of natural ways of taking care of the same conditions. People can do like the garlic, they can do like the green tea, they can exercise, eating the right food at the right time, the right portions. That could actually help to decrease their blood pressure to an extent that they might not need to depend on the medication for long term, is what I'm saying.
Dr. Patricia Noumedem, connecting from Howard University, where she is a associate professor. That lays your last statements lay the bridge to, or the transition to my next question to you. You are very passionate about herbal and natural medicine, alternative homeopathic medicine. Please, can you explain what all this means?
Very good. Again, when we talk about natural, complementary, herbal, homeopathic, or alternative, these are different terms that are used when they're describing something different from the orthodox or the Western medicine. So when we say Western medicine, what are we alluding? We're alluding to things like the Tylenol that is either over the counter, or a good example would be ibuprofen. That is a generic name. The brand name is Motrin, okay? Ibuprofen comes in 200 milligram, that is over the counter. And it also comes from 400, 600, and 800 milligrams, that is prescription. So whether it's the over-the-counter form or the prescription form of ibuprofen, it is considered Western medicine. It has to undergo some kind of rigorous studies to prove itself that it's effective, to prove that it is safe, or let me say relatively safe, because nothing is absolutely safe, right? So to prove that it's relatively safe, the benefits outweigh the risk, and also to be able to come up with, okay, what is the right dosage that we should give to like an adult? So medications, Western medicine, they have to undergo such rigorous, like scrutiny studies, and they are approved by the Food, Drug and Administration, FDA, before they are marketed. So when we talk about complementary medicine, we're saying that these substances, they are not considered medications. They could be foods, they could be minerals, vitamins, all of this natural stuff that can be used. And the term complementary is saying that it complements, so it adds to the Western. So the patient could be taking Tylenol for the headache or the fever, but then maybe just relaxation is a complementary therapy that the doctor recommends for that patient. Listening to music, maybe a massage, right? So maybe drinking some chamomile tea, relaxation, that could be a complementary. When you talk about herbal medicine, you're saying that the source is from a plant. So an herb, it comes from some kind of plant. It could be the leaves, the stem, but then it's a plant source. But then also saying that it is not part of Western medicine. The term alternative medicine just says instead of. So instead of taking the insulin for diabetes, maybe the cinnamon tea, cinnamon in your food can actually help to decrease blood sugar. And we have what I'm going to talk about later, alpha meta, which is some organic brown rice that has significantly helped a lot of people to decrease blood sugar. So those are alternative instead of the insulin, instead of the glucophage, metformin. Some patients have been able to really adopt the lifestyle of exercising, the discipline of having a routine exercise, 30 to 40 minutes a day. Not necessarily going to the gym, which is good, but then discipline 30 to 40 minutes, maybe vigorous walking or just jogging or swimming, or cycling, whatever the patient can really commit to. So that exercise and eating the right stuff, like I said, the cinnamon, the green tea, garlic, and also, not eating late, all of those lifestyles. So that's an alternative. And a lot of patients have been able to either decrease the number of medications that they're taking a day or the dosage that they're taking. Because when you're taking one medicine, that could be an issue, but you're taking two. Interaction, they interact with one another, and it increases the likelihood of what? Side effects, drug interactions, more vicious cycles. So that's what alternative is. And when we talk about natural, it can come from plant, it can come from fruit, it can come from a root, it can come from a natural source. It is not synthetic. That's what natural means. And then lastly, we say homeopathic. The term homeopathic was really saying it's a dilution. You know, again, they can take something that is causing the problem, they dilute it. So the diluted amounts can actually help the body, and it kind of helps the body to be able to take care of itself. So those terms are used, you know, interchangeably, but again, it's just saying that it is different from the Western medicine, whether it's over the counter or whether it's prescription medication.
Now, people watching you in the United States and perhaps Europe understand when you talk about over the counter and prescription medication. People back in Africa, you just go to a pharmacy and get medication, whatever the doctor writes. Sometimes people just go buy it, I want that, and they sell to them. Do they expose themselves to danger?
Excellent question. Oh, yes, they do. In America, we are privileged again. Even when you come to the pharmacy and you have to get over the counter, we recommend that you talk to the pharmacist, because when you just get the over the counter, yes, over the counter, like I gave the example, there's Tylenol, there's even ibuprofen or something, Maalox, you know, for gastrointestinal problems. The issue is that there's a potential for what? Interaction. And when we say interaction, it is not limited to interaction with just other medications. There are some medicine that should be taken on an empty stomach. When you take it with food, it can have a food interaction. There are some medication that should be taken with food. If you take it on an empty stomach, that's a problem, right? And there are some medication that cannot be taken with milk. So I'm saying all of that to say that whether it's an over-the-counter, it is so important that the patient, when they come to the pharmacy, when they come to the drugstore to pick up, whether it's what we call today, you know, the herbal medicines, you know, the alternative medicine, or over the counter, they should still seek advice from the pharmacist, because there are a lot of people out there that are taking advantage of the system to say, okay, well, because today people can just come in and get over the counter or alternative medicine, natural medicine, we're going to just produce whatever and put out there. So there are some things that we say, talk to the experts. If the expert doesn't know about it, then they know where to look it up. You know, we have references that we can check. You know, I can't stand here and brag that, okay, I know everything about every drug, but at least I know guidance. I know where to look. If you ask a question, I'm like, okay, I can get back to you. I can look it up in the appropriate resource that can help you, because there are a lot of gimmicks out there. So some of the things we say, besides talking to the expert, you can look at the label. Does it have United States Pharmacopoeia, USP?
Africa and my guests.
So yes, when I travel, like I said, can I continue? Like I said, I do local
Yes,
and
please,
I
go
do
ahead.
international missions. When I go, I've been to Africa a lot of, I've been to Ivory Coast, I've been to Niger, Cameroon a lot of times, I've been to Tanzania, you name it. The same problem, Liberia as well. When we go to these places, we try to help to educate the healthcare professionals, you know, that patients cannot just take medications haphazardly, because these medications have their issues. And it's so important. The patient might be pregnant, and if they don't talk to the doctor, there are some medications that, you know, it's going to harm the fetus. That's not good. The patient might have another condition, like somebody has asthma and they take a particular blood pressure medicine. The medicine will take care of the blood pressure, but it's going to exacerbate the asthma. That is not good. So all of these things are the reason why it's important to always see a healthcare professional. Thank you.
Dr. Patricia Noumedem, you are a doctor of pharmacy. What is the difference between across-the-counter medication and prescription medication? Because even across-the-counter medication has side effects. What separates the two? Apart from the fact that prescription medication is prescribed by the doctor, and across-the-counter medication, you can just walk in, pick whatever you want, and buy it. What's the difference?
All right, what's the difference? The example I used before, the Motrin is ibuprofen. Ibuprofen is considered a non-steroidal anti-inflammatory drug, which is really saying that it helps with inflammation, but it's not a steroid, okay? So it's a pain reliever. It can be used for fever. It's also used for inflammation like arthritis. It comes as 200 milligrams. That's over the counter. So that's a lower dose that we are safe, we are comfortable that, okay, the patient can use without a prescription. But if the patient needs something stronger, so let's say you can have two patients that have arthritis, pain, like joint pain, right? And some patient has mild. So they can have the over-the-counter 200 milligrams and they take it. But then if this condition is more serious, that needs more monitoring by the physician, they can get a higher dose, but at the same time, it only comes as a prescription. So we're saying before they actually get it, the doctor has checked them and approved, because the risk is higher with the higher dose. So definitely it has to be prescribed by the doctor. And for the patient to get a certain amount, the doctor has to confirm. And once that is over, and if they take it appropriately as directed, and they have to come back for a refill, the doctor has to examine them. So the higher dose, which is prescription, is going to require frequent monitoring of that patient, because there's a higher risk of side effects, toxicities that go along with the higher dosage. So over the counter is simpler. You can use it, even though we still encourage that the patient sees the doctor or the healthcare professional. But for the most part, for a prescription, it's higher dose, it's higher risk also. So it requires more monitoring of the patient so that the patient can benefit from it and not suffer the side effects or complications that can come with it.
Dr. Noumedem, you make no qualms about extolling the virtues of herbal medicine, natural medicines, alternative medicine, homeopathic medicine. At what point should somebody, a sick person, be going for any of these alternatives? Because, and I ask this question because when we get sick, the tendency is, the instinct is not to go for alternative medicine. The instinct is to go to the pharmacy and grab something there and swallow. So at what point does a sick person go for all these alternative medicine?
Very good question. You'll be surprised, Mr. Chamukong, that the resurgence for complementary medicine is really something. The numbers are just going up every day. And the reason is that patients are frustrated, patients are sick and tired of using Western medicines to no avail. What am I saying? I'm just saying that you take a patient, like I use a diabetic, for example. The diabetic is prescribed metformin, which is glucophage. Glucophage is a very good medicine. And yes, it's been proven to decrease the blood sugar, and also a number which monitors the way sugar is controlled for 3 months, called A1C. And that it does that very good. But it comes with what? GI, which is gastrointestinal. People can have diarrhea, other stomach problems, and it can also cause a severe problem called lactic acidosis. Now, when that happens, it's dangerous. They can be hospitalized. Some people have died from it. So what am I saying? When people have these chronic conditions, whether it's asthma, hypertension, diabetes, arthritis, HIV, you name it, and they are taking 1, 2, 3, or 4, or 5, I'm telling you, 9 or 10 medications to no avail. They are using it every day. Those that are compliant, they're using it as prescribed by their doctors. And 1 minute they feel good, next minute they don't feel good. They start developing side effects. It's costing their pockets. Guess what? They are saying, what else is out there? You know, about 13 years ago, when I embarked on this journey, you know, like to really, you know, I got handed the alternative medicine course to coordinate. After I did a paper and published with my colleagues, I realized that, wow, every day was an eye-opener that patients are so dissatisfied with Western medicine, and that's why it's a cry. They're saying, all right, is there anything else out there? I'm ready to try anything. Okay, we that are Christian, we're like, there's prayer. Pray the word of God. But then faith without works is dead. When you pray, God gives us wisdom to exercise, to eat the right kind of food, the right amount, you know, to rest and not worry about the things that cause stress and your pressure going up. So that is what I'm going to say, that interestingly enough, there are a lot of patients today that are not satisfied with what their Western medicines are doing. And therefore, whether they seek professional help or not, they're just getting the next thing to say, okay, brother X tried this, so I'm going to try it too. So, but I'm here to say, please don't just try anything out there. because whatever works for your twin brother, your twin sister, you are not exactly the same, your genes, because guess what? You might be allergic to one thing that your twin sister is not. So yes, before you grab the next thing out there, talk to the healthcare professionals, because there are some things that have been done to soak it. Even though these natural things are there are a lot of fake stuff out there, and we need to be able to guide the people so that they can safely use the alternatives.
A drowning person, Dr. Noumedem, you agree with me, would grab a crocodile to survive.
So
take
true.
somebody who has HIV, somebody who has cancer, somebody who has diabetes, BP, that's high blood pressure. Now, these are common diseases out there, especially among us Africans. I would say now common almost everywhere, in all races across the board. What should guide the choice to selecting, or the choice of alternative medicines? For those who are tired, they just want to grab something. And you mentioned the word fake. There's so much fake out there.
Yeah.
What's your advice? How does somebody get to grab A, not B?
Very good. I mean, I believe I already answered that question.
And how do you separate the genuine from the fake?
So what I'm going to reiterate is that please do not just grab anything out there. The same doctors, the same healthcare professionals that you're trusting with the prescription and over-the-counter medications, please take time to consult them. Consult us, about what type of natural medicine should I use. And like I told you before, I cannot stand here and brag that I know about every medication out there. But the difference is that with my expertise, I know where to go I know how to look at something, and there are some things that guide us. I can look at a label. I know where to search, where I can look to see, okay, well, are these studies genuine? Does it have the ingredients that it claims, are on the product? So the healthcare professional, not even having the answer right there, can help you to do this research on that particular product. So yes, there's a lot of fake out there, but there are some genuine products that I can attest for my own self, my own family, my biological church family, as well as a lot of my patients today. And that is why I'm like, you know what? We need to help, but there's a lot of good. So just because there's a lot of bad out there, we should be able to screen through and get the good and help people. So that's what I'm here to help.
Experience is the best teacher. Experience is the best teacher. I'm glad that you can attest to some of the very success stories you've had to have. Your family members, close associates, your church members. We will come to that and really ask you in detail what those testimonies are, what the evidence, exhibit A, as they say in courts of law. Before we get to that, somebody has posted a question about nutritional supplements, vitamin B, vitamin this. You go to all these vitamin shops everywhere. And at some point, we're beginning to hear that some are not necessarily genuine, legit. When you pick up a vitamin bottle, a bottle of supplements, what should you be looking for?
Very good. Again, the beauty of dietary supplements, multivitamins, if we were actually eating very well, then we would not need vitamins, to tell you the truth. But here again, I can speak for us in the United States, and the soil, it's like depleted. We don't have enough nutrients, minerals, coming. So the foods that are grown, a lot of time they say they're organic, they're not really 100% organic. So with that, a lot of the food we know, they are genetically modified, GMO foods, everything, the pesticides, synthetic, everything, trying to mass produce and fast produce. So when we get the veggies or get the food out there and we consume, there's really no guarantee as to the amount of nutrients that we're going to get. We need energy, ATP, for ourselves to be able to be productive, right? So a lot of the food we eat is just to satisfy our taste buds or to fill our stomach. It's not really giving us what we need, and it's producing acid in our body. So that is why, yes, vitamin supplements are important to be able to supplement, make up for what the foods are not giving. But also, there are a lot of vitamins out there that, depending on the formulation, the way they are formulated, guess what? When the patient takes that vitamin, it is still not helping them. Maybe it's just washed out. So again, that is what I'm saying to you, that what you need to do, we should stop by, you need to talk to the healthcare professionals. So looking at the
You are watching Dr. Patricia Noumedem, connecting remotely from Howard University, and we are talking.
yes. So in addition, just talk to the expert for real, because everybody does not need the same type of vitamins. So people need vitamins, again, depending on, people are taking some medication that they are deficient in A, B, or C. So depending on what they need. So again, that's a total, heavy, like topic that we can really dive into. But then in general, I would say you need to one-on-one. So it's like individualistic therapy. I would say overall, we are not eating the best foods, so yes, it makes sense to be able to supplement. But then if you make it a point, you see your doctor every year, and they tell you due to your blood what you need, then you want either to meet with the pharmacist, and they can help you to select the right formulation, the vitamin that is well formulated, such that you can get your money's worth out of it and not just waste your money.
Health begins with what you put in your mouth. That's why Dr. Noumedem began by saying, if your food is not medicine, medicine will be your food. You don't want medicine to be your food. And I know what it is, because I've walked down that road. There was once a time in the United States, I was in bed for 4 months and couldn't go to work. So I know what it means to be sick. We are doing this show and bringing somebody loaded like Dr. Noumedem, because we don't want you to go down that path some of us have traveled. Dr. Noumedem, I'm going to put you on the spot right now. What is your phone number? If somebody wanted to talk to you, I mean, you're sharing so much good information, and there are thousands and thousands and thousands and thousands of Cameroonians, Nigerians, Liberians, Sierra Leoneans, all over, Malawians living in our Washington, D.C. metropolis, and even those watching from abroad. What is your phone number? If somebody wanted to contact you, how does the person get to you? I'm not asking people to come to Howard University because you are teaching. They may come when you're in class teaching. So, okay, that's the question. From Veteran Chimanga writes, how do we reach Dr. Patricia Noumedem? I'm sorry, you're going to have to share your contacts. Yeah, I'm sorry.
I don't mind. Like I said, I am here for that. I have decided to just avail myself to help as many people as I possibly can. So my number is 301-807-5093. And yes, Mr. Chamukon, you can share that that's fine. I don't mind. And yeah, go ahead.
Yeah, I just wanted to repeat the number: 301-807-5093. And Dr. Noumedem is also on WhatsApp. So if you're overseas or outside of the United States, I do understand it can be expensive to dial, call us directly from your phone. You can reach out via WhatsApp. Now, I said earlier that experience is the best teacher. Now it's time, I'm going to ask you to share your experiences with alternative medicines. What have you experienced? What have been the results, and with what, for what illnesses? For example.
Okay, very good. I've had a lot of experience. Green tea, it's good. Green tea is good for blood pressure. Green tea can be used for a lot of, even to be able to stress relief. So the difference is chamomile tea can help to relax you. So from the natural things, I'm just going to say, like adding ginger, garlic to your foods. I talked about cinnamon before for like blood sugar control, people who have diabetes. So again, we talk about people listening to music, relaxation, walking, or just massage therapy. That's good. But then about 3 years, like I mentioned before, that about 13 years ago, I was privileged to be handed the course, Complementary and Alternative Medicine, to be the coordinator of that. And as a result of it, I've really delved into studying different types of therapies. But then about 3 years ago, I was connected by another person who said, well, Dr. Noumedem, because you're a woman with a big heart and you like to help people, I have come across something that has significantly helped my family. So these products that I'm going to talk about quickly, I'm going to talk about a few. And I'm an advocate. I've traveled to Canada, to Tanzania, and I have many other offers to Brazil, Romania coming up, and Australia because of the testimonies of people who have used this product, starting with, again, my own family, my sister in Canada. So the first one I'm going to talk about is the sanitary napkins. We all know, this is an example, we all know that when women turn 11, 12, or 13, they start having their period. And a lot of times women just pick up whatever is out there that is cheaper and they use. I know for a while that I thought urinary tract infections, I was really advising people against tampons because toxic shock syndrome is really deadly. But then I never paid attention to the type of pads that I was using or most women use and their detriment. So to just make a long story short, most pads, more than 97% of them are made the same way, and they are made with synthetic paper. And amazing, when the woman bleeds and the blood goes and mixes with that, she sits on it, that blood goes back in the woman that has mixed with dioxin, because the material that is used to make a lot of pads out there, they bleach it with chlorine, and the residue from that is dioxin. Dioxin is very cancerous. It's worse than arsenic. So when the woman sits on the pad, maybe eventually another time I'm going to do a demonstration, but then that goes in her, and it is responsible for cancers, responsible for a lot of infections, all kinds of discharges, foul smell, everything that the woman goes through. But today, like I said, about 3 years ago, this company JM, they have these products. They're all over the world today, in every continent. I can tell you because I've traveled and I know, they're over. So here it's called Angel Secret. So you can Google that, but you can call me. Angel Secret is really different because it's made with organic, it's cotton. It eliminates odor. The woman doesn't have to worry about foul smell. It's antibacterial. It is soothing, so you don't have to worry about rashes. It regulates menstrual cycle. It's anti-inflammatory, so the woman can kiss menstrual cramps goodbye. It helps to enhance blood circulation. It promotes healthy metabolism. It restores hormonal balance. And yes, hear me clearly, it helps to shrink fibroids. My younger sister in Canada had fibroids that she was ready for surgery. But after 2 months and a half of using Angel Secret, guess what? The fibroid, the doctor canceled the surgery. So I'm telling you, Google, contact me, and I'm going to help you. I'm helping a lot of people. And even women that are menopausal say, okay, I don't need sanitary napkins. That is true. But that's why that company thought about you. This is called Angel Secret Panty Liner. Every woman should have panty liner every day. And these panty liners, as well as the sanitary napkins, they have a technology called negative ion. The negative ion core, when the woman puts the pad on, it releases negative ions that are helping with all the things that I talked about. For the woman that is menopausal, the hot flashes are going to go away. I'm telling you, I've helped a lot of women in my church that say, you know what, Dr. Noumedem, when I used to feel like my head was in the oven, but after using your panty liners, now it's like you put my head in a refrigerator. Thank you. Even men with prostate issues, the negative ion technology, just by using a panty liner, what the medications could not do and all the side effects, the prostate is shrinking, and it helps to resolve some of the symptoms that they used to have, with urinary symptoms for the men. And how about erectile dysfunction? ED is a serious condition
That is a big one.
A lot of men and marriages. And I'm telling you, Mr. Chamukong, just by using a simple panty liner every day, there are men that are like, thank you, Dr. Noumedem, for saving my marriage, because it has improved what the Viagra could not do, what the Cialis, the Levitra, all those medications that, yes, they help to improve blood flow and they help them, but guess what? It comes with the risk of what people have died. You can Google, you see many people have had cardiovascular accidents.
This is Chat Night Africa, and my guest is Dr.
I recommend. Okay. The next thing I want to talk about is the alpha meta.
Dr.
Okay.
Noumedem.
Yes.
Yes, I would like you to repeat that particular one concerning erectile dysfunction. Believe me, when these things don't work at home, Madam is not smiling in the morning when you visit that home.
There we go.
Yeah, somebody told me that when you visit a married person, especially in the morning, come at the door. She opens the door and she is lighting up like Christmas tree. That's a reflection of what happened. That's a reflection of what happened in the night. By the way, Dr. B. Tazon from Noumedem, medical doctor, saying, kudos, she's enjoying the show. So I'd like you to talk. I'd like you to repeat that area about erectile dysfunction.
Okay. Number one, we know that it's God that created that, right? For marriages, marital homes, God wants them to have a good time. So many people, many homes, people look good, but they are suffering either because the woman is experiencing vaginal dryness from stress or so, but the men undergo maybe after 40 or sometimes just stress or medications that they're taking for their blood pressure. Side effects of it can be erectile dysfunction. So it can happen even with a young person, or it can be temporary, it can be permanent, it can be. So anyway, erectile dysfunction, there are a lot of medications. I named a few that are out there that are doing the job because they are helping the men, but then they come with a lot of complications. People are dying from strokes, heart attacks, all of those cardiovascular accidents. But today, this company, they have the Angel Secret, which is a panty liners that are helping the men both to have and maintain an erection. Yes. And like our brother Chamukon said, they are happy, their homes are happy, and we are here to just help families to be happy. Quality of life. So by using this, the negative ion technology, what it does, so it's just a small panty liner and just wet it and put it and place it, put on the underwear. It helps to do what? It helps, with the hormonal blood flow, which is what the Viagra's and all of those drugs do. It helps to improve blood flow and maintains with no side effect. I have a lot of brothers that are like, thank you so much. That today I'm happy again. My home is happy because you introduced me to this. And they don't have to worry about side effects of medications.
Madam is happy. Madam is happy. Husband is happy. Everybody is happy. Everybody's happy. The children are happy. Your visitors are happy because they come and have a wonderful reception at home. Wow, you are a blessing on this show today. I have to tell you that. You are a blessing. And you'll come back again. We're not done. I just don't know. If you have a wife, if you have a daughter having their menstrual cycle, I don't know why you should not listen to this broadcast. I don't know why you should not call Dr. Patricia Noumedem, Doctor of Pharmacy, 301-807-5093. If you're a man, and when we grow old, you can't perform as if you were 35. That's a fact of life. I don't know why you shouldn't watch this show. Men, any man, if you have a prostate, you can have prostate cancer. That's fact. Just as if you have a stomach, you can have stomach cancer. You have a brain, you can have brain cancer. You can have any kind of cancer. Based on what Dr. Patricia Noumedem has shared, I don't know why anybody should have any reason to not share this broadcast or to not go over it. If you're just joining us, you want to go back to the start. After this show, we are going to post it on our walls. You can go watch it there. You can share it. I'll be rebroadcasting this program, piping through different watch party times. Dr. Noumedem, continue.
Okay.
As a matter of fact, I knew you were going to discuss alternative medicine, but gosh, I didn't think that it'll be so deep. I didn't think that you'll have so much life-saving information. Well, if it matters to you, it matters to Chat Night. That's why we have Dr. Patricia Noumedem here. Over to you, Doc.
Okay, so the next product that, again, I'm just highlighting, and I'm hoping that in the future, we can do some demonstrations of these products. This is called Alpha Meta, M-E-T-A. Alpha, again, meta, metabolism, alpha beginning, so to just reset one's metabolism. It's organic brown rice in the real sense of organic. It's grown in Thailand in soils that are prepared. They use earthworms, they use fish and frogs, to be able to fertilize the soil. They don't use any synthetic chemicals, it's non-GMO. And again, it's harvested once a year, so they really allow the soil to really have the nutrients and everything. And once this rice is harvested, they grind it. This particular powder, they harvest the main ingredient, which is called alpha PSP, which is alpha polysaccharide peptide for short. And I'm telling you that for the past 3 years, I am in awe, because this is something that is instant. Once the patient just takes a scoop, puts in lukewarm water and stirs, and either use a spoon to eat it like yogurt or drink it depending on the amount of water, within 30 seconds, you feel the effect. Energy. It gives you energy. Like I said, a lot of the food that we eat out there, it produces acid inflammation in our body, but this feeds your cells. It feeds the cells. So this is like what I call the best fast food, because you can take it in your office, you can take it at home. It feeds the cells, and it helps to detoxify, it helps to regenerate, to repair, and to protect the cells. So even people who are healthy help to prevent all kinds of conditions, anti-aging, the free radicals that cause cancer. But those who have the condition, whether it's blood pressure, diabetes, congestive heart failure, arthritis, cancer, etc., it helps. I can give you quick examples, blood sugars reducing, with this, blood pressure. One of my friends, the father came from Liberia, and they called me, how can you help? We try to go from one medication to the other. The week that Papa started using this Alpha Meta, Papa is like, you know what, my daughter, I'm glad you went to school for pharmacy, because this is the best thing that has changed the blood pressure, the blood sugar. Another patient, after using this for 3 months, they took the patient off all the medication, the cholesterol, the blood pressure, the blood sugar. My own mother, arthritis and also high blood pressure, this is doing wonders for her. How about pain? Because of what it does to the cells, I have sisters in my church that have undergone breast surgery because of breast cancer, and they did not have to take any pain medication. All those Percocets and etc., strong narcotic, because they use Alpha Meta. So Alpha Meta is a food for cell. I'm telling you, it's for the healthy. And whether you're pregnant or whether you're breastfeeding, whether you're taking other medication, it's safe to use Alpha Meta. You need to try Alpha Meta. I take it every day, and people are like, oh, you're looking younger and younger. I say, well, it's the word of God. It renews me like the eagle, but it's because I'm doing the right thing. I'm eating the right food. I don't want to age. I want to stay young and healthy. I want to die young and healthy.
Dr. Noumedem, now I see the secret. I see you in church. We attend the same church. I see you in church bouncing all around the place. And as you talk, so many people are sending friend requests. I want to also thank Dr. Bita Zongpomundam. She pledged a donation. Thanks to that, to our pledge, we'll be getting some equipment, gadgets. Chat Night Africa will be taking a whole dimension from Meet Next Month. Thank you, Doc. Meet Next Month. And if you want to support, anybody who wants to support, this is community service we are doing. Anybody who wants to support this program, there's so much we can do when we bring our guests here. Before you go on with that, just hold that up. Before you go on, the question, if I met you in your pharmacy or in your faculty you are teaching, I would ask you, if I were your student, I'd ask you is, so much vegetables and fruits are grown with pesticides sprayed on them. What do I get to wash off the pesticides?
Wonderful, wonderful. You hit the nail on the head.
Many people are watching this broadcast now. And honestly,
You know what? You just took me to the next thing. Alpha Spin. Alpha Spin is a bioengineered glass. And this again, when we wash our fruits and vegetables and everything, this actually helps to wash away the pesticides. So you're talking about Alpha Spin. This bioengineered glass has been known to do a number of things. It harmonizes, like the negative effects of, like electromagnetic frequencies. Because as we go out there, your cell phones, your laptops, your television, your Wi-Fi, and also microwave and hair dryers, to name a few, the cars. There's EMF, electromagnetic frequencies, all over, right? So whether it's a pesticide with the food, just this particular alpha spin, the bioengineered glass, you know, it is what is doing it. You see what I have here on my neck? This is like the version that I have here. So when I'm sitting here and people are experiencing all the effects of radiation, radiation causes, you know, like cancer, you know, all kinds of acid in the body. What is happening to me is that I'm protected. So even when I want to cook my food, so the glass coming from that, it looks like this. So that's alpha spin. And I can show you two right here that I have handy. I normally have more than 5, because when I sit down, I form a quantum. I position it, it harmonizes the environment, so I'm protected. But like for the food in your kitchen, you can use alpha spin in your water. You can pour your water through alpha spin, and you can wash your vegetable, your fruits with alpha spin. Even the water they put in your humidifier, you pass it through alpha spin. It is structured. When the water is structured, it takes a hexagonal shape and your body can absorb it better. So your food is clear from all those pesticides and all the things that can harm it. But then this is also good. It kind of washes away like the acid that causes inflammation. And it also helps with circulation. You know, I remember having what, like a frozen shoulder after, I'm telling my age, when you get to 50, you start having all kinds of issues. The frozen shoulder that warranted all kinds of steroids, I said, no, I'm not taking that. I'm a pharmacist. I know all the side effects. Guess what? Just by using alpha spin and doing that, 2 weeks and a half, the shoulder that I could not lift up after prayer and everything, but God chooses to use a particular means to bring about the manifestation. God used alpha spin for me, and now I cannot stop talking about alpha spin. It helps with circulation, prevents strokes. So it's multi-purpose. It's like you asked me about the veggies, alpha spin, but I'm saying your circulation. People have come off aspirin because just using alpha spin. People have had strokes just being rubbed with alpha spin. Guess what? The limbs that they were handicapped, not being able to stand up, it's making a difference. So I am so passionate about alpha spin.
Now, before you continue with the other products, Dr. Patricia Noumedem, I have a question from Dr. B. Tazong Pomundam.
Wow, that's an active participant.
Yes, naturally, I can understand why she's asking this question I'm going to ask you. She says, is there any research to support the assertions that you're making? She would like to read them. She also wanted, and again, I understand you're a pharmacist. You understand that before any medication is put on the market, it goes through some scrutiny and all that. Journal of Medicines, you know that better than I do.
Yes.
Have these things been scrutinized? One, to make sure there's no side effects. Number two, to make sure it does what it says it does. That's in essence what Dr. Bita Zong Famundam's question is.
That's an excellent question, Dr. Famundam, and I'm so glad you're an active participant. I enjoyed your program last time, and I'll be glad to talk to you one-on-one. The answer is all of these products, when I came on board, I said they were what? Alternative medicine. They are not what? Western medicine or orthodox. So again, Dr. Tassel knows more than anybody else that when we talk about alternative medicine, they do not have to undergo FDA approval prior to marketing, but once they are marketed, you know, they want to make sure that, okay, yes, they are safe. So the answer is yes. As alternative medicine, there's a lot of, there's just so much out there that I can share with you. And again, if you look at even the bottle that I'm showing you, the organic brown rice, it has the stamp USDA on it, you know, also European certified. So that's to show that it's safe and effective. So I have a lot of that, you know, that, yes, I can share with you. But then they are not Western medicines, so they are not medications per se. They are just different natural products, so they don't fall under the Western, they fall under alternative category. But yes, they've proven their safety.
If somebody's listening to you now from Georgia, they're in Georgia or Carolina or Texas, and they reach you with, is it possible for you to send some of these products out of state?
Yes, the beauty is that this product, I learned about them about 3 years ago. I've been doing alternative medicine for 13 years. And 3 years ago, I learned about them, and I'm actively advocate, distributor, traveling and helping a lot of people. And I'm very satisfied with the results I'm seeing. But if somebody needs just to say that They are in all 5 continents. And it's such a blessing that a young doctor from Cameroon, and I'm also from Cameroon, he had studied in China and he got connected with some guy from Indonesia who had already for almost 20 years that they were actively promoting these products. But about 11 years ago, this young doctor, Dr. Raoul Jonu from Cameroon, got connected, and that's how he brought it to Africa. And he just wanted to help his country, Cameroon, but the results were so phenomenal that now almost every African country, I can tell you that they're really having a great impact, and it is amazing. So yes, so there are different locations in different parts of the world, every continent that we can help. So especially in America.
Honestly, again, if you have a girl child in your home who has started seeing her menstrual period or having a menstrual period, or your wife is having her menstrual period, or the menopausal period, or you're a man and you have a prostate. And I said on purpose, if you're a man and you have a prostate, you should watch this. I mean, what do you lose? I'm going to try it myself. It doesn't hurt me. It's not one of those vicious things out there with thousands of side effects. So I think it's a good thing to give it a try, especially as you are giving us testimonies of how these things have worked. Before you go, what's your last word? This is not your last appearance on Chat Night Africa platform. I can tell you that you have so much information to share. Before I ask you a last word, I'm going to tell everybody watching, if you have any questions on what we have discussed, please post the questions. Dr. Patricia Noumedem will go into the green room to answer your questions. She'll respond to you. If you want to call her, feel free to. She has shared her number. It is 301-807-5093. Let me lots and lots of things, alternative medicines, natural medicines, and so on.
I'm coming to get down. We're gonna dance.
Next medical subject on Chat Night Africa will be mental illness.
I'm coming. I'm dancing. I'm dancing.
Soon and very soon,
we're gonna dance.
The firebrand, controversial social caller, Mrs. Veronica Fortune, will be on to talk on relationship matters.
Boogie woogie. We're gonna dance.
Soon and very soon, Dr. B. Famunda will be on to talk on lead poisoning.
I'm coming.
I'm coming back.
I'm ready.
I will short term because if it matters to you, it matters to us. My name is Divine Chamakon.
I'm dancing.
That has been Chat Night Africa from Washington, D.C. metropolitan area.
I'm coming. We're gonna dance. We're gonna dance. I'm coming back. I'm coming back.
Thank you. Merci à tout le monde. Post your questions and Dr. Patricia Noumedem will answer them in the green room.
We're gonna dance. We're gonna dance.
That's been Chat Night. Goodbye.
We're gonna get down.